Hello everyone, it's Rafael Gutierrez again, and today I'm going to address a couple questions that were asked about the previous video where I was talking about how Sanshin breathing, I couldn't find any reason for it to be considered detrimental. Quite the contrary, I could see it as a benefit. Now, a couple people asked me about the Valsalva maneuver, and as it's used in Sanshin. Now, the Valsalva maneuver is when you breathe in deep and you allow the breath out, you force the breath out slowly, just like you would see it in Sanshin. So it's that. Now, the Valsalva maneuver, yes, it does increase blood pressure, but it's a temporary increase. And for you to really understand what the Valsalva maneuver really is, it is pretty much what you do when you're having a bowel movement. You take a deep breath and push it out. That's a Valsalva maneuver. So the thing is, there are some people who die on toilets, but what killed them, would you say it's a Valsalva maneuver or the aortic aneurysm they had, the Barian aneurysm they had, the heart failure that they had, or a weakness in the lung that maybe was irritated by that? What I'm saying is, if Sanshin killed someone because of the breathing, they probably would have died on the toilet, and that's not the cause of death would not have been the breathing. It would have been whatever was irritated by that, and they would have been killed because of anything. Now, one of the things that happens is blood pressure in a human is constantly changing. So one of the things, as you do exercise, your blood pressure goes up. As you go to sleep, blood pressure goes down. So these changes are natural occurring, and when people hear, oh, high blood pressure, they jump onto something that doesn't really mean what they think it means. Now, today's topic, what I'm going to talk about is how you would want to pivot when you're on a foot. Do you want to use the ball of the foot or the heel? Now, I'm only using anatomical structure. That's it. Now, there are some people who talk about how in certain Chinese medicine, certain areas of the foot activate other things. I'm not an expert in Chinese medicine, so I'm not going to even touch it. I'll let the Chinese medicine experts do that. The other thing that I needed to tell you is I am a professor, and this week I have to write an exam. I have to grade the exam, and I'm taking a week off to relax. And so I may be out of doing this for a couple days, couple weeks. But if I have a chance to, what I'm going to talk about is probably something such as the effects of adrenaline on the body, such as the effects of adrenaline on pain, on fine motor skills, on heart cardiovascular. By the way, adrenaline increases your blood pressure too. So again, if you're thinking the Valsalva maneuver killed people because they were doing Sanshin, if you scared them, you could have killed them. And so I'm getting off topic. So instead, I'm going to stop talking, and I hope you enjoy this video. And again, I will try to answer any questions that come. So please do. Goodbye. A lot of people who don't understand how to rotate their foot. Some people will tell you to rotate on the heel, here. Some people will say rotate on the ball, and we'll go out here to the entire. Some people will say ball, and what they're doing is they're doing the first and second metatarsals. These are the tarsals, so these two are the metatarsals. Now,
there is actually a better way to do stuff. There always is. And so that's one of the things I'm going to talk about, is why certain things are better than others. Now, the first thing I'm going to tell you is why it may not be a good idea to rotate on the heel of the foot. And for that, I'm going to use the entire leg. Now, when you're rotating here, one of the things that happens is your entire foot is rotating, and sometimes as you're rotating you may fall quick. If that happens, you end up having your foot act as a lever. And so as you stop in the rotation, you end up continuing the rotation here. Now the problem with rotating the knee this way is here. As we look at the knee, you have this cruciate ligament, these two ligaments that cross. The one in front is called the anterior, the one behind is called the posterior. You also have the collateral ligaments. This one here is your medial collateral ligament, which follows your tibia. This one here is your lateral collateral ligament, which follows your fibula. Now, when you're actually doing these rotations, you can see how it puts stress on the ligaments. As you're putting stress on the ligaments, that means these ligaments can tear. So spinning on the heel, if you accidentally drop your foot, can end up causing a lot of damage on the knee. So really not one of the best ways to do it. Now, if we're doing it the other way, if we're spinning on our foot and we stop, one of the things is it actually causes a stop, and everything comes to a stop. So you may not get the complete rotation, but you won't do necessarily damage to your knee. So it seems like going on the ball of the foot is better. There is something else that can happen here, though. A lot of times people don't necessarily look at the foot. Now, one of the things you can see is look at the size of the first metatarsal compared to the second, third, fourth, and fifth. You'll notice that the second, third, fourth, and fifth tend to be a lot thinner than the first. You can also see what I like to show as the lines. If you're standing on these two, you can see how the line goes relatively straight. So if we put the pressure here, we have more support here. If, on the other hand, we use this as our line and we're going perpendicular to it, we can see how the force is actually acting against the foot. Now, this does have a clinical implication, which is really important, because you also have what's called a dancer's fracture, which usually happens to people who are dancing who are not classically trained, apparently, or they land wrong. And that is this carpal here, this bone here, can fracture because when it rotates, it puts too much pressure. Now, if you look at this too, by rotating here, you can see that there's also pressure on this joint, on the joint here. And so you can even get a dislocation here. If you're spinning on these two, it's a lot rarer to have any of these fractures. So usually if you're spinning or if you're pivoting, it makes more sense to use the first two metatarsals than any of the other ones. As we're looking at how to do stuff, a lot of times if we look at the anatomy, if we look at the structure of the body, you can see that there are better ways to do it, especially when you see how the foot lies. We tend to actually see that there is more pressure, more arch support here than if we come here. Now, looking at the entire foot, the idea is if you're here, you have more support. If you come here, the lining here tends to change. So ideally, come in so everything lines up.